You are doing well. Warm welcome at today's live session. I'm Indu Malle, in-house fertility counselor and couple therapist of Fertility Dost. Hope I am audible or can you see me? Hello. Very good morning all of you. Hope you are doing good. Very warm welcome at today's live show. I'm Indu Malle. I'm a in-house fertility counselor and couple therapist of Fertility Dost. I hold master's degree in psychology and basic and advanced mental health diploma counseling course, and I'm certified fertility counselor and couple and family therapist also. So I'm glad that today I have got opportunity to talk about very overlooked aspect of endometriosis, because as we all know that endometriosis is chronic progressive gynecological disease in which endometrium like tissue grows outside the uterus in other organs like ovaries and fallopian tube, and it creates a lot of pain and inflammation and hormonal imbalance. So endometrium has other implications in terms of psychological, social, sexual, and relational social also. So I'll be talking about all those aspects because coherent understanding of endometriosis is very important. Then we can manage the symptoms. So please feel free to ask any questions if you have. Please stay till at the end. I'll be talking about self-management tips, basically how you can manage your symptoms and how you can revive your relationship with your partner. So, because of course the endometriosis is female's disease, but indirectly and directly it impacts the partners also and their relationship. And our sexual health is very important aspect of emotional and mental health, because it's a very overlooked aspect. People don't talk freely about sexual health, but sexual health is more than that, just the act of sex. It is a kind of emotional and intellectual intimacy between partners where both partners can share their need, want, desire related with emotions, and even sexual need and want can discuss freely and without any judgment. So because what happens, the female has a lot of sexual disorder due to endometriosis. Normal human sexual response has basically 5 phases, like appetite phase, excitement phase, and plateau phase, orgasmic phase, and this regulation phase. So that sexual disorder can happen in any phase, like hyposexual active hyposexual disorder, when there's a low libido due to fear of pain, the phobic anxiety happens. Dyspareunia is very common, uh, pain during sex or after sex. So what happens? The female has a kind of fear and they don't talk freely in front of partner, and the partners think that my wife is neglecting me or ignoring me. So it creates a lot of misunderstanding also between partner. So what I mean to say that you have to create a lot of understanding. When you will understand the nature of endometriosis, because it's an enigmatic kind of disease. Sometimes female are asymptomatic also, they don't have any kind of symptoms, but the endometriosis exists, and when they try to conceive and they don't get result, then the endometriosis can be diagnosed. So proper early diagnosis and interventions are very important to manage the endometriosis symptoms. And the most uh, anxiety is like when you hear that endometriosis is not curable, it creates anxiety. So it is a fact, it's a progressive disease, but it can be managed in a healthier way. You can have very good, healthy, satisfied marital life, sexual life, social life when you will work on that. So I'm coming in that point that how you can manage your endometriosis. Of course, you have to take the medical help, and through multidisciplinary approach, you can manage your endometriosis with proper nutritious diet, doing physical exercises, taking care of your emotions, leading basically healthy lifestyle and improve the quality of life is very important to manage endometriosis. Please feel free to ask any questions. I am talking about self-care tips regarding endometriosis. First of all, you should have coherent and very uh, important understanding about the symptoms of endometriosis, how your psychosocial sexual health can be affected by endometriosis. Sometimes what happens, we ourselves don't know what is happening with us, because a lot of psychological distress is very common due to endometriosis. Anxiety, depression, and other psychological distress can be seen in women, because a lot of the pain is the most important symptom of endometriosis, dysmenorrhea, when a severe menstrual cramp happens. But what happens for other people, it's like a normal menstrual cycle, and sometimes partners and family members think why they are making a lot of creating a lot of drama that it's a normal menstrual cycle, but for them, due to endometriosis, it's a severe pain and the others cannot understand. And pain has not only somatic component, it has emotional as well as cognitive component. So by understanding your pain and disputing your dysfunctional and unhelpful thoughts regarding endometriosis pain, you can reduce your pain. As I told, we have a cognitive component regarding endometriosis also. So, cognitive behavior therapy is very helpful to defute your dysfunctional thoughts regarding endometriosis and about yourself, because female has a low self-esteem and low negative body language, body language and image also due to endometriosis. What you have to do first and foremost key is to accept your endometriosis. If you will be in a denial mood, it will be difficult to manage your symptoms. So accept it and then start working on that. Biopsychosocial model of health plays very important role to manage your symptoms. What happens when female girls have a lot of pain due to endometriosis? They avoid doing physical exercise. But when you do yoga and physical exercise, the feel good chemical factor endorphin happens in your body and your brain, then you can have the capacity to tolerate the pain. So don't avoid your physical exercise. And female usually what they do, they use maladaptive coping strategies. Maladaptive coping strategies means like sometimes they isolate themselves, they don't talk about their pain, and then they feel lonely. So it is a time to talk about your symptoms freely to your loved ones, to your partner, then they can also understand what actually happening to you. Please feel free to ask any questions if you have regarding your symptoms, how you have to manage. Now I'm talking about how you can revive your couple relationship, because both have to manage the endometriosis symptoms, and partners, usually husbands, have to support their wives. If husbands are seeing this show, it will be very good. Later, if females are watching it, they can add their husband also later. They can see that how both together can manage their endometriosis. So, as I told, that sexual health is very important for mental and emotional health, and sexual intimacy is directly related to emotional and cognitive intimacy. There are several kind of intimacy between couples, but three are very important. Physical intimacy, that's sex. Cognitive intimacy, like communication, and emotional intimacy, where you can express your feeling freely. So when you will work on your emotional intimacy, so definitely you can increase your sexual intimacy also. So what you have to do, you have to do introspection about your thoughts, feeling, emotions and behavior. What is which gives you a good feeling? Make the list of all those things and then tell to your partner what turns on, what turns off, and your partners also can do this activity where you can share your emotions freely and in a safe manner. It is very important to enhance your sexual health. As I told you that many sexual disorder in arousal phase or sometimes aversion sexual disorder also happens female. They don't feel like engaging in sexual activity due to fear, due to phobia, due to anxiety. So it is a time to assess yourself and take a proper help. Some self-care help tips you can do with your own, and like CBT and sexual therapy, you can take guidance from the expert also. It is very important. uh, as it is a hormones related disease, so a lot of mood swings happens in female, and others cannot understand what actually happening, because at the last moment they cancel sometime that important event or any kind of celebration, so other relatives or dear ones feel that they are ignoring. So it is a time for all of us as a society to have awareness about endometriosis, because in my practice sometimes I get the teenagers to counsel when they have got endometriosis, and I have seen, because they cannot express their feelings, because fertility challenge is very much associated with endometriosis. I was counseling a teenager girl, and in when I dig deeper about her anxiety and concern, she revealed that she has a anxiety in future whether she will have babies or not. So we have only one kind of understanding, but with proper uh, information about endometriosis, you can have healthy, happy, and very good life. So I mean to say that please be aware and talk about it freely. It's not like a taboo topic, because it's related to menstrual pain. Female don't talk about it, and they have a lot of insecurity that husband will think, that the fear of abandon, sometimes it happens. So please take it as a opportunity to have a good awareness about endometriosis, and you can manage your symptoms very well. Emotion focused coping mechanism is very important, because emotional instability is associated with endometriosis due to hormonal imbalance. So meditation is very important, and it helps you to stabilize your emotions. And yoga also very good tool to manage your symptoms. Persistent and consistent yoga. In our fertility Dost, we have a multidisciplinary team where we do a lot of work to manage endometriosis, and lot of cases we have seen that uh, women has conceived naturally, and through IVF they have their bundle of joy. So please don't worry about that endometriosis can cause this fertility disorder and you will not able to become mother. It's not like that, but you have to take a lot of care, and then you can manage your endometriosis. So, as I told, sexual function is very important. Please revive your intimacy, talk your partner freely, and husbands also need to understand what actually that disease creates psychosocial sexual implication in women. If you will not feel good about yourself, about your body, then definitely you will not able to lead good, happy, healthy life. So first of all, please take it as a medical condition. It's not something defected inside you. Take it as a medical condition and work on that, and you can thrive in your life. So, if you want any kind of further help regarding endometriosis symptoms management, please feel free to connect with us, because diet plays very important role in endometriosis. And yoga, as I told, yoga meditation is a kind of tool to manage the symptoms of endometriosis. So what you have to do, most importantly, you have to increase your quality of life. When you will increase your quality of life in every area, in terms of your relationship, in terms of your own identity, in terms of your work, so definitely you can combat this endometriosis symptoms or disease, right? Uh, Now I want to tell you that how you can manage your symptoms in a cognitive level in the sense, because our belief system plays a very important role as in pain management. As I told, it's not only bodily related. A lot of dysfunctional belief creates the anxiety and pain. So whenever you have negative thoughts, so please try to change into in a positive one. I'm not saying that you can make your own affirmation or own mantra. I'm not saying that that take it as a toxic positivity, but you have to make your realistic affirmation by which you can have your own confidence about your body and about your own health. Uh, Please feel free to ask if you have any kind of questions. I will be happy to answer. And positive and respectful attitude towards endometriosis is the key to maintain the symptoms. So please take control of your endometriosis, though it is incurable, but of course it can be manageable, and with the help of multidisciplinary approach you can have your bundle of joy, you can have a very healthy sexual life also, and very good marital satisfied life also. But for that you and your partner both have to work on that. It's not like that it's only the female's condition and they have to manage. No, partners have to also help, have to support. For that they need to understand the uh, quality information about the endometriosis. Please feel free to ask our community, and you can take help if, in terms of any problem related endometriosis. If you have any kind of sexual dysfunction and disorder, your sexual life is impairing, please feel free to take help. If it is impacting your relationship, though sex life is good, but there is a lot of frequent argument, fights between partner due to mood swing and all, please feel free to take help. And as I told, in Fertility Dost, we have multidisciplinary team. We work on that, and we are there to support you, and we can help you out there. So thank you, all of you, for joining today's session. I'm sure it will be helpful for you. And if you have any concern, please feel free to connect in our official number. As a Fertility Dost team, we are there to help you. Thank you. All the best.